Welcome to Choices for Youth, everyone. For those of you who have never been here before, and I know a lot of you have, I'm looking at Linda Clemens-Burrell there. Her office used to be downstairs as a manager, so she spent a lot of time here. Ange Crockwell, obviously, Thrive was here many moons ago as one of the original partners in creating what is now known as the Youth Services Center or Cartersville Place. There's a number of names we call it. So welcome. It is fitting, I think, in lots of ways that this announcement's happening here today, all about wellness in our province and a path forward. More from the Premier on that shortly. This is the location of our Integrated Youth Services Hub site. We've been operating since 2004. Many years ago, we had the bright idea of putting up a building, putting a bunch of partners in it, and then putting up a flag to young people in St. John's saying, we may not be able to meet all your needs, but it's a pretty good place to start. What we didn't realize is that we were very quickly going to be overwhelmed by the need in the community. And that need has continued to grow. Good news, bad news story with Choices for Youth, we always talk about. There's a lot more young people coming our way year over year because there's a lot more to offer, and that's part of the support from provincial government, federal government, the municipality of St. John's, and a whole host of other partners. The bad news is none of those young people are coming here because life is great and this is a fun thing to do. We have a lot of young people in our communities looking for support and are in harm's way in all the ways that you can imagine that might be. So welcome, glad to have you all here. A couple things first, there are a couple of washrooms right here at the back. There's another one in around the inner room here. Emergency exits, obviously out this door. There's another door out the side here. And certainly down over the stairs will lead you to another exit as well. So one of the other pieces that happens at this site on the theme of wellness is we are part of what's called the Downtown Healthcare Collaborative. One of the things, as much as we designed this building to be an integrated site, probably for the first 10 or 12 years, it was really co-location. Wonderful work happened, but to truly integrate and work together as partners so that a young person walks in the door. The motto here is that young people shouldn't care who pays my salary or anyone else's salary here as long as they get what they need, because we're working together in a way that's truly integrated for the maximum impact and positive outcomes for young people. So on that note, I am actually going to invite the Honourable Dr. Andrew Furey, Premier of Newfoundland and Labrador, to come up and share the news of today's announcement.
Thank you, Sheldon, and thank you all for coming here today. It's a great day in Newfoundland and Labrador, a transformational day as we try to embark on a way to think about health and wellness differently as it touches every individual and every different sector of society. Thank you, Sheldon, and everyone here at Choices for Youth for graciously hosting us today and for your constant support to the people in our community. The work you do and many other stakeholders in the room do improves the health and well-being of young people in our province, which in turn benefits everyone in Newfoundland and Labrador. It matters. And it has a lot to do with what brings us here today. I want to thank Darla King, a VP of Transformation and Wellbeing from Newfoundland and Labrador Health Services, and of course my friend Amy Cody, President of Municipalities Newfoundland and Labrador, what they will do is highlight the scope of well-being throughout the community sector in our province. We invited you all here today as you play a critical role in our ability to achieve our goal on making Newfoundland and Labrador one of the healthiest provinces in Canada by 2031. I believe that together we can make that aspirational dream a reality. In my few years as Premier, it has been an honor to lead us to work together in that goal. And we are making incredible strides for all Newfoundlanders and Labradorians. There was a time, hard to remember now, just before I took office, where we struggled to make payroll. The former Premier had to write the Prime Minister because it was a struggle to borrow money. Now, 3 years later, we are enjoying unprecedented population growth, the lowest unemployment rates ever recorded. We are saving you over 8 cents a liter on gas and diesel, making it the second lowest provincial tax on gas in the country. We lowered our cost to borrow money while also saving in the first ever future fund. All of this as we build a modern Newfoundland and Labrador to meet the demands of a modern global economy, launching new industries for the people of Newfoundland and Labrador. Health Accord NL highlighted the importance of well-being, and all those key economic indicators that I just suggested are important drivers, important levers in the well-being. Thank you to Dr. Park. I decided to enter politics in the first place. I felt that having a different lens, a different focus, instead of on the operation, instead of why they need the operation, would make a transformational difference in how we look at health and the quality of life that Newfoundlanders and Labradorians ultimately experience. So I am proud today that as a government, we will be placing a heightened focus on these particular determinants in our spending and policy decisions, focusing a sharper lens across all government departments to support you, the stakeholders, and people who access your care. Well-being is an essential aspect of the overall health of Newfoundlanders and Labradorians. And for too long, we have just looked at simple parameters like life expectancy and how we treat strokes and diabetes and heart disease. We need to look at the social determinants of health and those that are driving those very diseases. We are focusing on creating a shift in how we collectively make life better for Newfoundlanders and Labradorians. That includes empowering you, the community, to take meaningful steps, to work with us, to support you, and to change, to drive change for those social determinants of health. Of course, we already have a strong record on these issues, but there is much more work to be done. And our record includes the fact that we spent over $500 million to help erase the pressure attached to the high cost of living that is a real problem for families across our province right now. We increased spending on income support, increased the minimum wage, and introduced a basic income pilot project for youth receiving residential services. We introduced a new provincial affordable housing program that will build over 850 homes over the next 3 years. We introduced and expanded a physical activity tax credit to break down potential barriers to recreation and sporting activities. We have made record investments in healthcare, including new family care teams that will provide access of primary care for 80,000 Newfoundlanders and Labradorians when fully in place. We have championed and funded initiatives to support age-friendly communities, senior social inclusion grants, and accessibility. We have prioritized affordable childcare from an average of $40 a day in 2020 to $25 a day in 2021, and now there are over 8,000 childcare spaces operating at $10 a day. And we are not stopping there. To continue building on this momentum, to become one of the healthiest provinces in the country by 2031. So I am pleased to announce today that the week of September 17th to 23rd, 2023, will mark the first ever Well-Being Week in Newfoundland and Labrador. This will be a time to come together as a province, to learn from each other, to engage, to support and take action around the many factors that impact our health and our quality of life. There will be events and initiatives held throughout the province to bring awareness to the influence of these social determinants and factors and how they impact our healthcare outcomes, our quality of life, and what we can do together as communities, as stakeholders, as families, and as individuals to drive that change in how we think about health. The week will include a mix of community-based events and government events. And many of the partners in this room will have already been engaged, and we look forward to working with you to further develop plans towards not just this week, but the rest of our lives in changing and transforming how we look at healthcare. So thank you all again for being here today. It's an honor to serve as your Premier as we continue to have a focus, a laser focus on you and your health care and what that means in your overall well-being. Thank you very much.
Thank you, Premier. So the joke going around the office yesterday was, ask Sheldon to talk for days, he'll talk for days. Ask him to MC, and he will forget multiple things. So I want to acknowledge some folks in the room with us today. So we have Johannes Lamp, if I pronounce your name correctly, President, New Nazi Government, Minister Bernard Davis, Minister of Environment and Climate Change. Bernie, good to see you again. Minister Tom Osborne, Minister of Health and Community Services. Tom, I was speaking to you earlier. Minister Lisa Dempster, Minister of Indigenous Affairs and Reconciliation. Lisa, always lovely to see you. MHA Jim Din, leader of the NLNDP. Good to see you, Jim. And Dr. Pat Parfrey, Deputy Minister of Health Transformation. And Jerry Earle, President of NAPE. Welcome to all of you. So I think I've caught up to what I was supposed to do. In response, I mean, we work with young people every single day. To say that systems need to get better at collaborating is an understatement. I think we've known that for a long time. In terms of the direction, social determinants of health, it's not a new term, but how do we get there? We've often looked at systems that I've said in the past, I don't know if it's been appreciated. We have systems that are addicted, pardon the unfortunate use of that term these days, to crisis. I know many people working in the community, good friends, colleagues. I know many people in those systems, good friends and colleagues. They care about young people just as much as I do. But if we have a system that historically has taken a very crisis-driven approach to things, one, it's the most expensive response we can think of, but often doesn't lead to the kind of outcomes that lead to long-term solutions and well-being of, all folks that we're concerned with. So that's from Choices of Youth perspective, which is very consistent, I think, with the direction the province is going, but how do we get there? How do we transform systems from a crisis-driven response to a more holistic, early intervention and prevention-based response? We all know an ounce of prevention is worth a pound of cure. That phrase has been around a long time. How do we get there in terms of how we operate? Going back to my original comment around how the Downtown Healthcare Collaborative, as one of a number of examples, we've got an amazing partnership. It's evidence-driven. So if anyone has caught, the series we did recently with The Signal on CBC, we brought in many community partners. We brought in national partners as well. And the saying goes here at Choice of Youth, I want to spend 10% of my time really, truly understanding the scale and scope of the issue and challenge in our community. I don't want to underplay it. I don't want to minimize it in any way, shape, or form. But I actually want to spend most of my time talking about solutions. And they're out there and they're available to us. We have a province that can and should be a leader in this country in every area involved in the announcement the Premier made this morning. How do we collectively get there is a challenge in front of us. We know there are real needs in the community that are growing day by day. One of the things that we, at the Vulnerable Sector Task Group, I think it was called during COVID, incredible work, community, government agencies working together through probably one of the more significant crises in our province. Many of us, including our government partners, were very concerned what comes out of COVID. And unfortunately, because as I said, nothing but a pandemic made risk factors for young people go down, I can guarantee you that. But unfortunately, what has proven true is that the risk factors have continued to rise with the hopefully reduction in COVID and all that brought with it. The issues remain, and they're growing exponentially if you look at from an affordable housing crisis to now what's happening from an addictions perspective. These are all indicators of all the parts of systems that need to be addressed and changed and have a focus on early intervention and prevention. So I will stop here because otherwise I'll just go on and on. The right way to think about everyone in this room, including the media, for example. Would any of us be here if we didn't know where our next meal was coming from? Would any of us be here if we didn't know where we're going to sleep tonight? would any of us be here if we were under constant threat of violence or some form of trauma? Absolutely not. There's nothing so special about me that means I could survive all that and still be here with you today. That is crystal clear, as we need to make it in terms of how our province, including the community, needs to respond to what's going on around us. We have an opportunity, and the solutions are available to us. So I'm going to stop, because Jen is waving at me. And I'm going to invite Darla King. Where's Darla? Over here. Okay. Vice President of Transformation Wellbeing with Newfoundland and Labrador Health Services.
Good morning, everyone, and thank you, Sheldon. It's certainly my privilege to be here today with the Honourable Dr. Andrew Furey, Premier of Newfoundland and Labrador, and with Sheldon and Amy, and with all of you who've come to help us launch Wellbeing Week in Newfoundland and Labrador. So I'm going to start by talking a little bit about the Health Accord. I'll look at my friend Pat when I do that. Because the Health Accord has challenged us to do a lot of things to improve well-being for people in Newfoundland and Labrador. It's challenged us to reimagine our healthcare system. And it's also asked us to recognize that our health is influenced by a lot of factors other than just our healthcare system and the medical care that we receive. It also recognizes things like education and employment, the environments that we live, work, and play. All of those things have a very important impact on our health and well-being. Those things collectively, as we've heard today, are called the social determinants of health. So within Newfoundland and Labrador Health Services, we certainly intend to improve our focus and increase our focus on the social determinants of health in all of our programs and services. As a new single provincial health entity, we really have a great opportunity. We have 5 legacy organizations that did lots of work around well-being and wellness, so we can build on the excellent initiatives that are already happening. And we have a new provincial public health program that's going to help us lead this work into the future. So I'd like to take a few minutes just to talk about one of the strategies that we'll be introducing as a new initiative. You might have heard us talk about, and actually the Premier mentioned, our family care teams. So family care teams is really a new model of care where essentially we're bringing together teams of healthcare professionals like doctors and nurse practitioners, social workers, therapists, who can come together collaboratively and work to help individuals in a holistic way around both individual needs and the needs of the community. We're soon going to be introducing social navigators into this important team. So basically, a social navigator will help individuals to work and look at these individual factors or sort of non-medical factors that might actually influence their health outcomes. So for example, they might connect people with things like Family Resource Center, with housing supports. They might make referrals to the public library or fitness groups in the community, or link them with programs and services around education and income support. So those are some of the individual things that we might be looking at doing. We also know, however, that in order to truly impact well-being at a provincial level, we really need to look beyond individual care. We know that within Newfoundland and Labrador, there are groups of people who have circumstances that make them more vulnerable to poor health outcomes. We really want to strive for health equity so that all of these groups of people will have the same opportunities to live a long and healthy life. So to address these types of situations, we first need to better understand these populations. So one of the other new initiatives that Newfoundland Labrador Health Services is looking at is actually introducing a new health information system. So this is essentially the way that doctors and nurses and healthcare providers document medical care and patient visits and the like. We're going to be introducing a new system that's going to be much more robust and will help us be able to use information in different ways. We intend to use this system to help us learn more about our populations and the social determinants of health that they experience. We know that if we had this standardized, measurable, and actionable social determinants of health information, that we'll be able to learn more about sort of the specific needs of these groups, which will help us to be able to target activities. So for example, if we learn that there's a particular community or zone within our health authority that experiences high levels of youth homelessness, we might reach out to, for example, to Choices for Youth and ask them to partner with us to actually develop programs and services to support that population. That same data will help us to evaluate how effective these
So carrying on with the theme of Sheldon forgot some people, we also have Minister Paul Pike, Minister of Children, Seniors and Social Development, and Minister responsible for Newfoundland and Labrador Housing with us. Minister Steve Crocker, Minister of Tourism, Culture, Arts and Recreation. Trent Langdon, President of the NLTA, and Sherry Hilliard, President of CUPE. Welcome all. Save the best for last, I figure. So thank you, Amy, for your comments. I mean, obviously, we've started engaging in some dialogue with the Health Authority now around the concept of integrated youth service delivery across the province, which is part of a movement across the country. I think Nova Scotia just announced 8 integrated youth service delivery sites. I have it on good authority. New Brunswick are now set to announce sites as well. So Choices for Youth, in partnership with the provincial government and now the federal government, we're at the forefront of, what is a transformation in the youth mental health system and addiction system in this country. Important to note with that work, and Darla talked a lot about the evidence. We need the evidence of the need, evidence of what's effective, evidence of what's working, and so on, because people are doing better at the end of the day. That model itself is incredibly data-driven. So the Health Canada, for example, through the Canadian Health Institute for Health Research, is launching and investing over the next 5 years in research specific to integrated youth service delivery, because there's a deep commitment on the part of all levels of government and community to moving in that direction, because it is going to help us do better for the folks that we're most concerned about. So on that note, I am now going to invite Amy Cody, President of Municipalities Newfoundland and Labrador, to the podium. Welcome, Amy.
Premier Furey, my friend, Sheldon, Darla, invited guests, ministers, Mr. Dean. I'm very pleased to be here today on behalf of Municipalities Newfoundland and Labrador, the organization that represents 275 incorporated municipalities in our province. We always say that municipalities are the order of government closest to the people. It's true. Municipalities are, for the most part, the places in which people live. Municipal leaders and staff know the people in their communities. They know the challenges that they face. They are often the first to hear them and the first to be told about them. I've been a councillor in the town for 14 years. I've been the president of Municipalities Newfoundland and Labrador since 2021. I've seen changes over this period. I'm well acquainted with these challenges that we face in our communities and as a province. These are, without a doubt, difficult times for so many people. We need to work together. We need to support each other. At MNL, we have always talked about a need for a seat at the table, and more recently, the importance of being an equal partner in the work that we collectively do for the people of this province. Being here today is significant. Through sustained engagement and collaboration, MNL and our members have been at the table for consultations on the Health Accord. We have had many opportunities to speak with and hear from Dr. Patrick Parfrey and Sister Elizabeth Davis on the vision for achieving better health outcomes for Newfoundlanders and Labradorians. More recently, staff at MNL have been working diligently with the Health Transformation team on how to best engage with our members as we all acknowledge the essential role with our provincial and our federal counterparts to support our members. I also recognize the need for community partners to work together. I see many of the partners in community with whom we work with on a regular basis in this room right now, including our host, Choices for Youth. I look forward to Wellbeing Week and continuing to work with our partners. I'm excited to hear from our members about all the things that they are doing to mark their good work to date on well-being. And most of all, I'm excited to chart this course forward as partners in well-being. Sheldon, thank you for hosting. Darla, for your words. Premier Furey, Thank you again for allowing M&L to have a seat at the table. Thank you.
Thank you so much, Amy. And our partnership with M&L is very valuable to us as well, looking at housing solutions in different parts of the province, along with Newfoundland and Labrador housing as well. One small snippet I will talk about before we clue up for today is when you look at well-being and what that means and how we need to work together differently. One of the things that we have grown into over the years at Choices for Youth as an agency that fundamentally still exists as a housing and support agency for young people, what about all the life areas that are impacting on the ability of young people, once they have a house, to maintain a house? So all of a sudden, Choices for Youth is operating multiple social enterprises, employment, businesses designed and purpose-built to support young people around their needs. One of the pieces of feedback we gave over the long term, over the course of their lives themselves, it's not easy. It doesn't happen overnight. But once young people get the support they need, you'd be surprised what young people can do. I've been doing this a long time. I've never met a young person who doesn't want a better life. I guarantee you that. So it's up to us how to come together and help them achieve that. So thank you very much for being here. I'm going to clue it up now. I think we have some delicious treats from Crosscraft Bakery, a wonderful Choice for Youth social enterprise. And I